Hello, I'm Dr. Stephen Fox, and welcome to my cosmetic dental practice. Today I'm going to show you some of the procedures that we do in dentistry and how we get to a result that the patients love and changes their life and changes their smile. When we do a veneer, we try and maintain tooth structure. We strip the tooth of the tooth structure minimally so that we can bond a veneer to the tooth. The veneer is bonded in a unique way. We use calcium and phosphate cements to bond the veneer, and that way it repairs the tooth at the nano level. It changes the color of the teeth, it changes the look of the teeth, and it really gives you the Hollywood smile. When the teeth are chipped at the bottom of the teeth, we don't prepare a crown or do a root canal. What we do is add a bonded filling to the tooth structure with cements and with agents that repair the tooth at the same time at the nano level. And that way it bonds to the tooth, it repairs the tooth, but you don't have to go through a crown or a root canal or an inlay. It's a very, very futuristic way of repairing the tooth structure. There are some people that have trouble sleeping. They snore, they gasp for air, and there's a solution. It's called a dental appliance. You no longer have to have CPAP unless you're a severe case. After a sleep study, an appliance is made, it's inserted, and you're able to sleep again and live your life the way you used to live it. So we prepare a crown by reducing the tooth structure in a minimal way. We make a zirconium crown with no metal in it, and because it has no metal in it, it doesn't have to be as thick when we make the preparation. The zirconium is hard, its color is just like the color of your teeth, and we cement it in with a bonded agent that's called nanodentistry. It has calcium, phosphate, and fluoride in the cement so that it adheres to the tooth, but it also repairs the tooth. That all came out of my work with the American Dental Association and the National Institute of Standard and Technology 25 years ago. We work in close collaboration with our own laboratory technicians. We make sure that the veneers fit beautifully, they're thin and the color is right, and we make sure that the crowns are thin, no metal, and that the color is right, so that you get that Hollywood smile.
For Dr. Fox, we provide custom shade matching, which we do for many doctors, but Dr. Fox actually really likes to send a patient over. We take the color and actually finish the veneer and send it back to him. If there's anything that has to be changed, whether shape-wise, color-wise, the patient comes here, chair side. And that is the best way and most precise way to have everything matching with the patient's mouth. The thickness of the laminate is usually 0.5 millimeters, and it actually blends in right with their smile.
Since I began practice 39 years ago, I've seen an enormous evolution in dentistry. We no longer use gold or metals. We use zirconium, and we use a lot of the products that put calcium and phosphate back into the teeth to rebuild the teeth at the nano level. And that's a natural outgrowth of all of the studies that I did 25 years ago with the federal government and the American Dental Association. And that's why they call me an icon and the father of dentistry in the 21st century.